Hey, it's Dr. Hakky with Atlanta Cosmetic Urology. I'm here again, we're going to do a reservoir review. I'm going to start off with the oldest reservoir. This is the spherical AMS. It comes in 65 and 100. You can see this reservoir is not completely inflated, it's deflated, and we got the measurements here of 4.9 by the length of the neck here is coming in at 2.9 or 29 millimeters, 2.9 centimeters. So this is good for lower volume patients, like smaller cylinders, so you could inflate it less. It's less likely to get the lakes, but it has a high volume, like surface area volume ratio, right? It's gonna have a larger footprint. It's not efficient with space. It doesn't have a lockout valve, and I don't think I'd use this that much, but I think it's still, this is the older spherical, this is still available, 65 and 100. Okay, in 2010, Boston Scientific came out with the Conceal. It's actually a better design. It's not spherical, it's actually like a red blood cell. The most efficient way to transport liquids is actually this shape. It's like a donut shape. It's the most efficient way to transport. So I do like the design of the shape of the reservoir. Can get the lakes because of the soft design. Okay, it does have no lockout valve, right? The length of the tubing here again is a little bit longer from the fat segment, being 3.5 centimeters. Okay, and the actual length of the actual device itself is, that's excluding the thick portion, is 9, right? And this thing will inflate up, right? So the up to this implant is it's going to be pre-coated, and the pre-coated rifampin minocycline will last up to 7 days. It is a little harder to insert as a surgeon, right? Not from a patient standpoint. From a surgeon standpoint, I find this a lot harder because it can fold. As you can see, like it's soft, right? When I'm trying to insert it into the body, I'm trying to get it into a hole, and you see how it kind of just like folds on itself, right? Intelligent design, a little softer material, it's a little harder to use. Coating emission will last longer in the minocycline rifampin. You can't customize it. There's no lockout valve. It's not FDA approved to go ectopic or submuscular. However, you could place it there. I think it's a great design. Just needs a little bit of tweaks from it. This came out in 2010. Okay, on to the Coloplast Cloverleaf Reservoir. This came out in 2011. It comes in 2 sizes. One is 75 and one is 125. I exclusively use the 125, and you can see it's got that cloverleaf shape to it, right? Now, if you look at the length of the tubing on this one, it's 4.4. Why is that good or bad, right? It's good and bad because if you can bury this tubing and you find the long tubing and the thick tubing, you can cauterize along this and dig this out of somebody, right? It does have a lockout valve. It's coated with Bioflex, and it's got more rigidity to it. So if I'm trying to put this inside of a body in a hole, it goes in. It didn't fold on itself. You see that again? It doesn't. It just slides right in because it's got that rigidity to it. Patients won't feel the rigidity. So I think as far as shape goes, Boston Scientific's got my favorite shape. As far as volume goes, this is more volume. That's 100 in the Conceal and 165 in the spherical. This is 125, so I can put more in this. You won't get the lakes and the lake effect. You do have a lockout reservoir right here. It's the only FDA approved submuscular reservoir, right? So pros, more volume, right? Cons, a little bit more rigid shape, right? And it's only gonna elute for about 72 hours, the whatever you coat the device with, right? And then pro/con, it's got a longer segment of stiffness, right, towards a lockout valve. I will tell you as a surgeon, right, I do feel very confident when I see this, and I know I got about 2 cms till I see the lockout valve when I can change this. Now, when you change a patient from an American Medical Systems implant to a Coloplast implant, right, that space, usually it'll occupy it, and you can get it in the same space, and you can try to just express it out. When you switch back the other way around, because this is a little fatter at the neck, if you look here, this has got that lockout valve, it's a little fatter. I have had AMS reservoirs kind of start to herniate down, need to put an extra stitch in. So those are like caveats for it. So the spherical reservoir 100 cc's can lake up on you. You got the 7 to 10 days worth of elution of antibiotics. That's great shape. It's nice and soft. The tubing's kind of short right here, which is pros and cons, right? No lockout valve. This is a larger shape, so more hydraulic pump, right? It's got a little bit of a rigidity to it, so it's easier to insert. I don't like the cloverleaf shape per se when it's deflated. I don't think it looks natural. The lockout valve is kind of wide, and when changing out can create problems. You can get herniation if you're not putting another Titan implant in with a cloverleaf reservoir. Otherwise, the reservoirs themselves have come a long way. I think there's minimal issues with the devices themselves. We didn't do the length of the Coloplast implant versus the spherical conceal is 9, right? So it's a lot longer than the American Medical System's 8. So it's a longer implant. It's a little bit more voluminous. So you can see that the conceal is better as far as footprint goes, and the worst footprint, of course, is going to be the spherical. You can see the footprint elevation-wise. The highest elevator is going to be the conceal. Now, these aren't inflated. You could say, Hakky, these are not inflated. This is going to inflate into a spherical. This is going to inflate into a flattened spherical, and this will be a sphere. So this is going to have the highest topographic rise, or the worst, shape. This will have the second, because it's still going to be flattened, but it'll still be more rounded, and this will be the flattest implant, right? So as far as shape goes, I think this is the best shape. This has got the best as far as like lockout valves and as far as rigidity for insertion surgeon-wise, right? They're just caveats between the two. I think for the most part, you can't go wrong with either the conceal or the cloverleaf reservoir. If you're going submuscular, I would favor the Coloplast reservoir just because you have that extra lockout valve. If you had an infection situation, I think if you're washing the space out and you're putting back in again, I think the data is the same. You may feel a little bit more comfort knowing that the Boston Scientific implant would elute for longer, more antibiotics. But that's a complete reservoir review in the United States. Of course, we didn't include the Rigicon implant. And I'm Dr. Hakky, and we approve these penis messages.